What is therapy like? What can you expect from therapy? If you've never been to therapy, you might have a lot of questions about what to expect, and I will actually link to a couple of folks I follow on social media who talk about their own practice and what they talk about and what their perspectives are. So just to give you a sense of that. Therapists are obviously human, so everybody comes with a little bit of a different flavor. And one of the downsides of therapy as a mental health support is it may or may not be covered by your insurance. And often it depends on what kind of practitioner you're going to see. So that's something you're going to want to look into if finances are a challenge for you. Hopefully, at least in Canada, we're moving towards better mental health care, and this is something that can be included in our universal health care that's supposed to cover everything. But let's not hold our breath for that. So what do you expect from therapy? So you will usually start the conversation with sort of a consultation. Most therapists I've ever worked with will do like a 15-minute phone call or a 20-minute phone call, something so you can learn more about their process and how they do things, and really just a chance to meet them. Chemistry in the relationship is really important because you have to be able to say things to them that you would not ever say to anybody else. That's really where therapy can be extremely helpful. Those deep, dark secrets, those things that you don't like to tell other people, you have to be able to say them to this person. And their job is to non-judgmentally support you and help you kind of reflect that a little bit differently. So therapists will first start with kind of building rapport with you. They'll get to know you, your situation. The very, very first question they will ask you is, what brought you here today? What made you want to come into therapy? And then people are trained in different kinds of modalities. One of the most common types of therapy you'll encounter for depression and anxiety is cognitive behavior therapy, or even just cognitive therapy. The whole concept behind it is the idea that your emotions are a result of your thoughts. And another thing I'll post in the notes for the video is actually a link to kind of the core of this, which they're known as cognitive distortions. So the idea is that you are thinking in a way that is creating this emotional state within you, and you're believing it all to be true. And so that's what you'll often find talking to a therapist is they will look for those cognitive distortions and they'll ask you, well, what's your evidence for that? Why do you think that's true? What is it that makes you think that that person meant that? Or what were you thinking at the time of this? So once they've established some rapport with you and you feel safe and comfortable, they're going to start poking and they're going to start pulling apart what your beliefs are. And that's a very, very good thing, because very often with depression and anxiety, how we think really does impact how we feel about things. And we have a tendency to believe everything we think and believe everything we feel. We take them as truth, and they're maybe not necessarily. Therapy can work on and off. If you're in a really, really low place, a therapist might recommend that you see them a couple times a week, once every 2 weeks, whatever. And then you kind of usually wean off. I know for me, when I first started working with the therapist I'm with now, I was going every week. Now I'm down to more like every 3 to 4 weeks, because I have so many things in place. It's usually just a check-in. Is there anything else I can be doing? Is there something that isn't working? And maybe why isn't it working anymore? And just to kind of touch base with some of those cognitive distortions that I'm prone to. Contrary to popular belief, therapists don't give advice. That's not what their job is. Their job is to reflect your own thoughts and emotions and ideas back to you so you can look at them more objectively and say, is that really true? And decide then, what do you want to do with that? Most therapists I've ever worked with too will also offer resources. So they may have some videos you can watch, books you can read, apps you can try, you name it. And they will absolutely give suggestions in that sort of way, but generally speaking, they're not giving you advice. That's not how therapy works. So if therapy is something you want to try, it's a great idea to reach out to different practitioners. If you want recommendations, ask friends, family, do they know somebody who works with folks who are in your position right now? A lot of times, if you've gone to see a doctor to be diagnosed for your condition, you will often get referred to a therapist. Usually they have contacts. I certainly refer clients to therapists as well. I will get folks who come and talk to me, and they're they are actually feeling, clinically anxious or clinically depressed about their career decisions. So that's something I've done in my space as well. So hopefully that gives you a bit of insight into what to expect if you've never done therapy. I promise it's not nearly as scary as you think. It's a really neat experience, and it's one of those things where once you find that click and you find that good relationship, it can be extremely beneficial to your mental health. See you next time.